Hello, this is Dr. Lorelei Walker with the Social Safety Initiative, and welcome to our series, Stories from the Community. Today I was able to speak with Todd Shoemaker, author of The Blessed Overcomer, about his experience right now in a COVID ward, as well as what it means for him to participate in a community who wears masks, and what it means for our future as faith-based institutions and organizations for social justice and change to participate in inclusion of public health prevention. We encourage you to register for our 90-minute class on the 8 safety protocols so that you too can participate in stopping transmission. Because as Todd says, if we can wear a mask and keep our distance for 100 days, then summer is going to be just okay. And thank you, Todd. Thank you, Laura. And thank you to your community. Your work has a lot of meaning, and your time today and your stories has an impact.
You and I were able to meet a bit ago, probably about 2 years ago at this point, and I got to know a lot more about you and the work that you do. And one of the things that struck me from a public health perspective right off the bat was, and we'll talk a little bit about your physical transformation and miracle to running, but the sex trafficking work, the awareness and prevention you did for years and years, really struck a chord with me. And I just want to acknowledge that work that you did. I remember before I met you, your weight was low. A third, I believe, of your year was spent in the hospital. And then I heard a little bit about this just amazing transformation you had, and the faith-based community really needs to hear the miracle of it, because I believe you hit your 2,000th mile of running just recently.
Well, last year I hadn't been able to physically run in 10.5 years, and last year on October 31st of last year, I hit 1,000 miles for the year.
Mm-hmm. The Overcomer, we'll make sure to link to it. You have a documentary coming out soon, I believe, potentially.
Yeah, the documentary's done. It's coming out in the next 2 weeks for some different premieres that we're going to show. And I have my nurse in right now, so that's why you might hear some. I might have to step away for a second, but I think I'm okay.
That's okay if you do. That's a reality of your situation right now.
Yeah. So I think it's about time for the COVID treatment for the day. So,
what would treatment look like?
It's all IV. I had plasma on Wednesday, and that's just the antibodies of people that have had COVID, their antibodies, and they give it to me, and the hope is it helps fight things off a little quicker, plus it hopefully kickstarts my immune system to start developing some antibodies themselves.
That sounds like a fantastic treatment. I'm not a medical doctor, but given the variant strains that are going around and the length of time it takes to make a vaccine, it seems hopeful that you might have kind of the latest and greatest the human body has to provide for antibodies. I'm so grateful that we were able to coordinate this, and you're able to do it right now. Is you have a powerful story without COVID, and then now you've had the tragedy of contracting it, I believe to the extent of having pneumonia in both lungs, as well as the physical fallout of COVID. Anything you want to say about that and the diagnosis and how it's been?
Well, I will say I've been through a lot, in my life health-wise, but it's probably ranks up there as probably probably the worst that I've had to go through. It's just totally zapped my strength. The coughing fits, are extremely rough, and it's not like a little, thank you. It's not like it's a little 5-minute coughing fit. It can, coughing fit can last up to 2 hours. Just really struggling, to get a breath out.
And you're on a COVID ward, I imagine, right now.
Yeah, not on my regular floor. Yeah, I'm on the COVID floor right now, and everybody's taking great care of me here.
And Florida especially has been struggling.
Yes.
And I was looking up the death rates, the daily deaths of 180 people a day just in February, the highest. And we can go to almost zero with universal masks by June, or it can go up to 220.
Right.
It's in the social distancing, the mobility's only gone down by about 20%. So I fear for this constant recirculation and the mutation rates that there's going to be a lot of suffering. And so convincing people to just do those behavioral changes, if we could just do them really well for like 2 months,
Right.
then maybe, more of your faith-based community and my young moms with children, and
Yeah.
we can hopefully turn that. We have a lot of younger people being COVID positive now too.
Well, and I'm thankful, that the church that Laura and I attend, that, it's required that you wear a mask inside, that, you can't walk into the building, without having a mask on. So that's comforting for us, especially now, but it's very comforting to know that there are, a lot of churches, and there are a lot of people in the faith-based community that are taking it seriously, but it's the few that are not taking it, and not just in the faith-based community. I'm sure in every area and walk of life, there's people not taking it seriously. But if people could just jump on board and say, my thing would be, my thing is, if, as a parent, if a doctor said, hey, you need to do this for 100 days so your child can be safe, every parent would do it. If the doctor said, hey, your child needs you to do this for 100 days, every parent would do it. Well, my challenge to people would be, think about your children, grandchildren, nieces, and nephews, that for 100 days, if you could just wear a mask, you could be potentially saving their lives.
I so appreciate both your call to action for parents, but also calling out the inclusion that different communities create, and whether it's a faith-based community or other ones, but especially the faith-based community with young parents and children coming in, and also our elders walking in and being relieved that it's okay that I practice prevention, health prevention, sickness.
Right.
It's been so targeting by especially every walk of society to wear a mask and to do these things. So we're trying to build a very inclusive mindset of community resilience. And I do call on especially communities like the faith-based community who really need that social interaction, and that provides such a resilience to people from isolation to be in person, but also you can do it safely.
I mean, well, the thing is too is, I kind of look at it this way, with these masks, I mean, literally you can have anything written on those masks that you want, designed the way that you want them designed. So it's kind of like, for me, it's an opportunity to wear a mask with a scripture on it, or, my mask to say, I love God, or love people, or whatever it might say. All that does is just give an opportunity to have conversation with other people, so it's almost like, I try to tell my Christian friends, it's an opportunity to really be able to share your faith, because one, you're sharing your faith by respecting those that want you to wear a mask, and Lorelei, for me, it's the biggest thing is, even if I was like, I'm not going to wear a mask, that I would never go into a building, any office, or any place without a mask, because to me it's just being respectful. Whether you agree with the mask or you don't agree with the mask, to me it's just an issue of respect. It shouldn't be an issue of, oh, well, somebody, the government's trying to take my rights. No, it's just being respectful, of not knowing, if I walk into a grocery store, I can guarantee you I'm probably going to run into somebody that's dealing with some kind of health issues and their immune system is compromised. So why would I want to take the chance of possibly doing something as dumb as not wearing a mask and know that I might have infected that person and change their lives forever?
That brings to mind the importance and the focus we have on workers. As a labor leader, when COVID hit this last year, I too go into grocery stores and shop for the family. And knowing that the workforce that has to go out in public or that has to drive buses are typically less resourced. They're typically communities of lower income, and typically have more chronic health conditions in their families. So it's a kind of a double whammy for the workforce to be lower paid, and then more likely to get sick.
Right. I mean, if you go into a grocery store, you're going to be in there maybe 30 minutes, 45 minutes. What's the big deal about wearing a mask for 30 or 45 minutes? You want to take it off when you get outside to your car? Take it off. But my big thing is I would hate to know, that would be like, Lorelei, that would be like me leaving the hospital today, knowing that I still have active COVID and pneumonia, and going into a grocery store with no mask on.
Yes.
People would say, oh, well, that's crazy, Todd. That's not nice. That's not respectful. And I go, exactly. But I didn't know. I had no idea when I got COVID. So nobody else knows until they start showing symptoms that they have COVID. So by you walking around without a mask, you could literally have COVID and be passing it around and not even know that you yourself have it.
Well, and Todd, as I understand, nobody in your immediate circle has it. So that means that when you wearing that mask literally did save people that whole time you were asymptomatic and infectious.
Right. Yeah, it's very true. Because, you know the stats better than me, but it can lay dormant for, 1 to 14 days before showing symptoms. So
that's a lot of people.
I think, so you think to yourself, if you go to the grocery store maybe twice a week, and maybe you go out to dinner or something like that, there's a lot of people that you're coming in contact with.
One of the things we do at the SSI is we teach people about the breath cloud. And, COVID, with poor ventilation or people in close proximity, that breath cloud that streams around your face and as you walk, kind of almost like a fart cloud does whenever you let one rip in public. We teach people that. And if you're thinking about walking around a grocery store for an hour and you have this stream of infectious particles, or you're not wearing your mask right, heaven forbid you're trying and it's not appropriately there, then it's just streaming around children and other people around you. And gosh, if we could see it coming out of our mouth, we would be horrified at the number of people affected in that hour.
Oh, yeah. And, the thing is, too, is not only should people be wearing masks or face shields, but they have to make sure that they properly fit. Because if they're not properly fitting, then every time you're breathing or sneezing, if it's not tight around your face, that's coming out. Plus, somebody walking by and sneezing is, that maybe doesn't have a mask on. That can get into the mask. So it's making sure that you're wearing a mask or a face shield, but it's also making sure that those are secure, that you're not letting anything out or letting anything in.
We're looking to launch a 1, 2, 3 Your Mask Saves Me campaign focused on transit. Both the workers, the operators, as well as the ridership, especially because there's a lot of transit dependent ridership, and people still have to go out to go to work. And so our goal is to help people fit their mask, because if you're wearing a mask, darn it, you're trying already. So let's do it the right way.
Right. Yep.
Yep. When Cindy, and that's how Todd and I know each other through, as my mother, when your sister, when Cindy flipped the mask industry, or flipped her business for masks in March with me, the first thing she did was she made a unicorns can dab mask for Adeline. And that kid wore that mask that Granny made for 4 solid months. That thing looked beat, but it still worked. But it was her way to get unicorns in the discourse. People would talk to her about the unicorns. They'd smile, even though they were kind of scared with the world. Yeah, it was. I like your idea of getting scripture into the discourse through mass.
Well, and that's why I said, I have masks that say, in racism or in human trafficking, or some other social issue. And, people are always like, oh, well, what does your mask mean? Or where did you get that mask? Or, oh, I believe what you believe in, So, and especially the human trafficking, a lot of people will stop and go, I know I've heard of it, but I don't know a lot about it. Can you tell me about it? So, these people that complain about wearing masks, it's like, it's like you're just missing, one, you're missing out on helping not spread the virus. But two, you're missing out on really having quick conversations with people. And I'm thinking, if you own a business, make a bunch of them and with your business name and pass them out. It's like, why make it so difficult when you could turn it into something so positive? And like you said, if everybody would just mask up for the next 100 days, you would just see a huge decrease, I believe, in cases. And, we would see people not have to go through, what I'm going through and what my family has to go through with, wondering, at the very beginning, was I going to make it through this or was I not going to make it through this? And no family, needs to deal with that.
Especially when it's preventable.
Right, especially when it's preventable. People just have to, get over, all these different conspiracy theories or all these different things that they hear and just, go to the CDC or go to a reputable medical place and really read the facts, and I think if people would just start doing that and not listening to, Joe Smith down the street, who took science in high school, who says this is all a hoax, instead of listening to folks like that, and truly listening to Dr. Fauci and some of the other medical people that are, on the TVs and stuff like that, or even in their own community, people like you and people who are, in the health profession, and listening to them, that's who we should all be listening to. We shouldn't be listening to somebody that has no medical history background at all.
When my colleagues and I really started this work, it's been a pretty long path for us in trying to turn the tide of behavior while watching these numbers get out of control for the systems. And one thing I remember telling a family member, kind of an extended family member, when, they were pretty blasé about everything, was that, everybody kind of has an opinion about what kind of herbs and supplements they could take that work and how to stay healthy. But if you were to contract a brain cancer, you probably wouldn't go to your neighbor to get advice.
Right.
Or you'd probably listen to your pharmacist. And it's like public health professionals, that's who we are for the population.
Right.
So,
Right.
but I do want to acknowledge, though, that for everybody who may find themselves, having not wear a mask and hearing this, or, really believing in some of those theories and then becoming more informed, I'll say that our leadership nationally has done a disservice to us by not funding science education and education itself and public health funding, like especially in our state. It hasn't been there for 20 years. That's a whole generation of people that were kind of ripped off from having the knowledge they need to make these decisions today.
Right.
But you are a beautiful soul, you and Laura and the family, and wherever that soul takes you or you take it, we're always thinking about you, and as Adeline would say, attached through the heartstrings, no matter how far or near they are. So thank you for this gift today. Thank you for the gift of the overcomer. I look forward to the documentary, and however we can engage in this work going forward to support you and the mission of the communities you represent, and lead in and support, really. Thank you, Todd. Thank you.
Oh, thank you so much for taking the time.
That concludes our interview with Todd Shoemaker. You can find out more about the 8 safety protocols at socialsafetyinitiative.org. Till next time, mask up.